Positions of the body. First, of course, the normal anatomical position. I suggest that you do this thing, okay? So stand straight like this person. Have your arms at your sides, your toes facing forwards. Stand tall, look straight ahead. That's the normal anatomical position. Why are we talking about this? See, when I ask you to flex your arm, okay, if the starting point was like this, would you be able to flex? No. So there has to be a fixed starting point for any action. This normal anatomical position is the fixed starting point for any action. Okay. So what is it like? Standing erect, face forwards, head and eyes looking straight, palms forward, thumbs laterally, toes forward. That's the normal anatomical position. I'm sure the image is giving you the general idea. So let's talk about some simple terms, supine and prone. I'm sure you know what is supine. Supine is when you lie down on your back. See the sweet little baby lying on his back? Lady lying on her back? That's supine. So many times when your patient comes into the OPD and is very ill, he may come in a supine position, right? Versus a prone position is when the patient is lying on the front part of his or her body. Some patients sleep in this position. Some patients have to lie in this position because they may have a back injury. There's so many reasons for a patient to lie in prone position. Okay, so these are terms you need to understand. Lateral position, the position in which many of you sleep with an arm under your head on the side, the same side leg on the bed, and the other side leg may be flexed. This is a lateral position. Okay. The upper leg is usually slightly flexed to maintain balance and steadiness of the position. When would you give this position to your patient? Maybe patient is comfortable in this. Maybe you want to do a rectal examination. You want to examine something. So that's when you give patients this position. Many times, specifically Sims position is the word used. See this term here? Sims position. So this is similar to the lateral position. The leg on the bed is straight and the leg on the top is flexed and resting on the bed as seen here. So much so that the gluteal region and the rectal region is quite well exposed. This is when this is the position given when you want to do a rectal examination, give enema to the patient. Okay, that's when this position is given. Students, if you're liking this lecture, do please like, share and subscribe to my channel and hit that bell icon. For detailed anatomy lectures with diagrams, surgical anatomy videos, downloadable notes, MCQs, visit my website vbanatomy.com. Link is in the description section. Come. So what's the next position? This looks familiar. I'm sure many of you know what this is. This is lithotomy position. When do you put a patient in lithotomy? Think. Obviously, when the patient is delivering a baby, when you're examining the patient's perineal region, that's when you want your patient in this position, right? So pelvic and perineal manipulations, that's when you have this. So sometimes even urological manipulation, you want your patient in this position. What is it called? Lithotomy position. Fowler position, when the patient is lying partly up as shown in this image. So this is a very restful position for patients. Many times the nurses will come put patient in a Fowler position for giving food, for even sometimes just talking with the patient. Okay, so Fowler position is quite often used in hospitals. Patient is quite comfortable breathing in this position. Next, Trendelenburg. In common man language, what would you call Trendelenburg? Think. Head low? Absolutely. So, when the head is low and the feet are high, when you want more blood to go to the patient's head, you put patient in this position, which is called Trendelenburg position. What is it called? Trendelenburg position. You will often put patient in this position when you're doing abdominal or pelvic surgeries, so the blood will go further inferiorly, or even in shock management. So what is reverse Trendelenburg? Obviously, the feet are lower and the head is higher. When would you put the patient in this position? You want to operate on the head neck region. You want more blood to go down. That's when you do this. Thyroid gallbladder surgeries. Right. So if you're liking this lecture, do please like, share and subscribe to my channel and hit that bell icon.